Here with you. So Dr. Skepti's kind of filled me in on everything. We looked at your looked at your CT scan that was performed at the outside. So our next recommendation would be to get a specialized MRI that we do here at UCI to particularly look at this area and then to also see if there's any other area that's inflamed. Instead of trying to repeat the colonoscopy, we're going to try to get the report from outside on Monday to see what it did show, to see what, to kind of gather a little bit more information. I do have a few questions for you. Have you had any weight loss since the onset of your illness? How much weight have you lost?
Like 30, 35 pounds.
About 30 to 35. Why is that? Is it because you have pain? Is it because you have decreased appetite?
Loss of appetite, over the course of the last 5 months.
Okay.
Sometimes I'd go 2 days without eating.
Okay. Because of the pain?
Right, the pain.
Okay.
And
Does eating aggravate the pain? Does it make it worse?
Sometimes it does. Depends on what you eat and, at what time you eat, but it's more so just the fact that when you're in pain, just the idea of eating is just not very pleasant.
Okay. Have you ever had any increasing abdominal distension or your belly feel like it fills up, or have you had any episode where you're vomiting, anything like that?
Yeah, I've been vomiting, before I was admitted here, 2 or 3 days before.
Okay.
Before you were at the other hospital also?
At Chapman?
Yeah.
Yeah, well, I was here right after this.
Okay.
Anybody in your family with inflammatory bowel disease or Crohn's disease or ulcerative colitis? Who in your family has inflammatory bowel disease?
Paternal uncle.
What does he have?
He I think he was diagnosed at first with Crohn's, but ended up he passed with intestinal cancer and other cancers. Yeah.
Okay.
But they thought it was that at first, but
okay.
Yeah.
I see. And then with regard to your illness, how long have you been suffering from all of these symptoms? When did your symptoms first start? For about 5 months. So 5 months ago, if I talked to you 6 months ago, you were completely healthy and normal.
Yeah, 180 pounds and totally fine.
Okay. So one of our thought is that we're going to go through with this MRI. The MRI will help me look at the small intestine a lot better. This MRI is one of those specialized MRIs that we do here at UCI. Very few places do it, but it's kind of a sucky test. So what they make you do is they make you drink a very large volume of liquid to hopefully distend up the small intestine so that we can get a good look at the entire small intestine, right? So why am I doing an MRI? The one thing that I want to do MRI is I want to make sure that you truly have something called a phlegmon, which is a large area of inflammation.
Did they do an MRI last time you were admitted? No.
They did a CT scan.
Oh.
Yeah. Typically when you go through the ER, the CT scan's the quickest way to do it.
Okay.
Because it takes 10 minutes. This takes 45 minutes. Right?
How soon can they get one of those?
So the team's going to put the request in hopefully today or tomorrow.
Okay.
So that's the first step. The next step is based on the MRI results, then we'll have to sort of regroup about what we need to do next for you, okay? Because we need to gather more information. Because if it is a abscess or a fluid collection, when I did my training at the Mayo Clinic, I actually published a study looking at when patients present with a pocket of infection related to Crohn's disease. Because Crohn's disease, if you think about the colon, right, it has a lot of layers or inflammation in the colon. And so typically when the inflammation starts out, it starts out within the first layer. And so people don't have symptoms from that. And then it sort of progressed into the next layer, and then the next layer, and then the next layer. And then from that, people start getting more and more symptoms, like you have. And then that's when they start having weight loss, which is not uncommonly seen, right? And so when it's what we call transmural, what involves all of the layer, we call it a phlegmon, or a large area of inflammation. But we want to make sure there's no abscess, because based on the study that I did, even with an abscess, we kind of need to manage it more with initial surgery to take care of it, because abscess is an infection, right? And so we need to treat the infection like they thought you had appendicitis, right? That's why they rushed you off, and they want to make sure they can drain, get rid of that appendix if that was causing the problem, right? And so we just want to make sure you don't have a pocket of infection, okay? And then based on the result of the MRI, you and I will regroup and decide what we need to do next in terms of treating you and taking care of you. Okay? And then we'll also talk about the risks and benefits of the certain drugs that we might use to treat Crohn's disease, if that's what we felt that you had, based on all the information right now, right? Because we met you for the first time, so it's hard for me to give you a diagnosis without really getting a full picture. And I don't think it's fair to you, right, to say this is what we're going to do, right? Because one medication doesn't fit all, and one, one type of you might need more than one type of medication, right, up front.
The GI
So we'll have to
that
kind
saw
of-
him at the St.
Mhm.
Joseph,
What's the name of the doctor who saw you?
Safe.
Abu Saif,
Okay,
you know him?
I've heard of him.
Yeah.
Mhm.
And he's the
And he saw you
original one.
initially when you were really sick?
Well, at St. Joseph, yeah, he came in and then he could not tell us 100% that he's gone, obviously. He couldn't.
Uh-huh.
He did the blood test that goes to San Diego.
Uh-huh.
This
He
was a
has
couple.
done
This
that
was about
as well.
6 weeks ago.
Uh-huh.
Yeah,
Yes.
yeah.
Uh-huh.
So, and he did not actually at that time at St. Joseph even put any kind of antibiotics, try to get that thing under control.
Uh-huh.
We were in St. Joseph for about 2 days, and when we come out, they were going to do the colonoscopy there. He said it probably takes longer. We can do it at my office after, his clinic or whatever it is.
Uh-huh.
So we went and did it over there. Everything that he said, it was.
And the colonoscopy was just a couple weeks ago, is that what you said?
Yes, it was
Okay.
About 3
3
weeks
weeks
ago.
ago.
Okay,
Yeah.
so we'll get that report.
Yeah.
But he did not put him on any kind of medication
Okay.
until, I say, what, 10 days ago?
No,
12,
more than that.
2 weeks ago.
2 weeks probably.
Okay. What's the,
Priscilla, I guess
what's the name of that doctor again?
I would say,
Say
I have his-
S-A-I-F, right?
yeah, I have
Uh-huh.
it,
Dr.
yeah.
Safe. So we'll have to
No,
get those numbers.
Abu Safe. Abu Safe.
One word?
One word? Oh, okay.
I have it
First
here, I
name's
just,
ALAA.
and
Mm-hmm.
so the
So you put him on Apriza.